The topic is constrictive pericarditis, and what's happening here is after an initial episode of pericarditis, the pericardial effusion tends to get organized, and with time there is fibrin deposition, and the pericardium gets thickened, and there's fibrous scarring, and there is obliteration of the pericardial space, and there might be deposition of calcium, and this would result in a rigid and stiffened pericardium. And there are again etiologies such as idiopathic, post-cardiotomy, chest irradiation, viral pericarditis, the autoimmune connective tissue disorders, malignancies, and tuberculosis, and then uremia and end-stage renal disease. And many causes are common, and some of the common causes would be uremia, post-surgical, tuberculous causes, radiation-induced, viral, idiopathic. The stiffened pericardium would impair the diastolic filling, and there would be an increase in and equalization of the diastolic filling pressures in the cardiac chambers. Right-sided heart failure, basically, the cause at times would be constrictive pericarditis, and it often goes unnoticed and undiagnosed as a cause of right-sided heart failure. And in this condition, in constrictive pericarditis, there's decreased cardiac output and increased venous pressures, and one would see symptoms, often patients with symptoms and signs such as jugular venous distension with a small sign being present, and then there's a pericardial knock and early diastolic filling sound, and then hepatomegaly, which is tender, and then there's a pseudoedema, and then ascites, and then of course pulmonary congestion along with orthopnea, dyspnea, cough, and then decreased cardiac output would lead to fatigue and muscle weakness and weight loss, and ECG findings would be non-specific, and one might see low voltage QRS complexes or slight changes in T waves, and the X-rays would be showing pericardial calcification and at times normal or slightly enlarged heart. Echocardiography would show pericardial thickening, and then the echocardiography is very handy in differentiating between the constrictive and the restrictive patterns, and then there are several features that support the constrictive patterns, as thickened echogenic pericardium and tethering of pericardium to the myocardium, a septal bounce being there, and dilated incompressible IVC, and inspiratory variation in mitral flow velocity, and then expiratory reversal of hepatic vein flow, and CT and MRIs would also show thickness of pericardium and calcification if it's present, and then they would also show septal bounce, basically, which is an evidence of ventricular interdependence, and then they can also provide insights into the other anatomical information, which can be helpful in diagnosis, such as diagnosis of constriction, and one can find information such as the engorgement of IVC and hepatic veins, and the reasons for those. Right heart catheterization is important tool, and it often helps confirm the diagnosis. And one could see the elevation and equalization of the right atrial diastolic, right ventricular diastolic, the left ventricular diastolic, and pulmonary capillary wedge pressures. And there would be a prominent X and Y descents, and that would show up as a M or W configuration on the atrial pressure, on the right atrial pressure tracing, and the early diastolic filling of the right and left ventricles would show as a square root sign or a dip and plateau pattern. Treatment-wise, one could use diuretics and low salt diet to take care of the edema. And often folks with this condition have folks with this constrictive pericarditis, they have a resting sinus tachycardia, but that's compensatory, basically in the setting of a reduced stroke volume. So one should, while looking at this condition, basically one should avoid the beta blockers and calcium channel blockers. And the definitive and the treatment of choice is the pericardiectomy, and in almost half of the patients, this condition is completely relieved, and in most of the patients, basically, there's a symptomatic improvement. But in situations where there's an underlying restrictive cardiomyopathy, pericardiectomy basically is less effective, and in situations, those are the situations such as when the constrictive pericarditis is developing due to irradiation